put them on if you don't want to. Great, I think we're live now, Anna Marie, are we?
Yeah, I think we are.
Great. Great, thank you very much, Anna Marie, for putting us live out on YouTube, I believe. So welcome to the Scrutiny panel that is looking into the impact of COVID. And I'm Councillor Deirdre Costigan. I'll be chairing the meeting, and my co-chair, Councillor Nigel Sumner, is also here. And we have an array of councillors and officers tonight that are going to look at this issue. This is our second meeting, so follows on from the previous discussion that we've had. So I'll just kick off with the agenda. The first item is apologies, and we have apologies from Councillor Carlo Lasardi. I'm not aware of any other apologies. Anybody aware of any other apologies? No, great. So item 2 is, I should just say to welcome, as we're kind of on membership, just to welcome Councillor Donnelly to this committee. I hope you enjoy it, Councillor Donnelly. We look forward to your participation tonight. So item 2 is urgent matters. I haven't been informed of any urgent matters, so I think we can move on. Item 3, declarations of interest. Does anybody have a declaration of interest? I'll give it a second. Nope, I'm not getting any hands up. So the next item is matters to be considered in private, item 4, and I've not been notified of any matters to be considered in private. So we then move to item 5, which is the minutes of the previous meeting. Those minutes were attached. Does anybody have any issues of accuracy with the minutes of the previous meeting?
No.
Nope. Can we accept them as an accurate record?
Yes.
Right.
Yeah.
Chair. Yeah.
Any matters arising on the minutes of the previous meeting? I'll give it a second if anyone wants to put their hand up.
Not at all, Chair.
Thank you, Councillor Mahmood. Anna Marie, I just had one matter arising. It was just, we did raise at the last meeting about this idea of a poverty strategy that Southall Community Alliance had raised. And we were going to look at ways of kind of kicking that off, now, rather than waiting until the end of the municipal year. Could you give us a quick bit of feedback as to where that's got to? I think there's discussions internally with officers, is that right?
Yeah, so that's the stage that it's at, Councillor Costigan. We are discussing with senior officers about how best to progress it prior to the recommendation going forward to Cabinet.
Great. Okay, no further matters arising, I believe. So I think then, having dispensed with the preliminaries, we can get into the meat of tonight's meeting. We have got rather a packed agenda, so we'll get started straight away. So the first item, item 6, is an update on from Public Health. We have Anna Bryden, who is the Director of Public Health, and Anna is going to give us a presentation followed by questions on this issue. And apologies if there's dinging in the background, it's when people join the meeting, so apologies for that. Okay, Anna, do you want to take over?
Thank you, Chair. Good evening. I'm Anna Bryden, Director of Public Health. If you can hear me okay, I'll just keep the camera off because my signals are not great. Do let me know if this comes through. Can you see those slides?
Yes.
Yeah, great. Thank you. So I'm just going to give an overall update from a public health point of view in terms of the COVID pandemic, but I've also been asked to particularly focus on the council role in supporting the vaccination programme. So I'll run through the situation, and I'll also introduce new points on testing, which you might not be aware of, and then I'll run through the vaccinations, the progress for the programme locally, the priority groups, and particularly focus on inequalities, communications and engagement. So in terms of the current situation for Ealing, on the graph here, the green Ealing, so you can see that we have been at a very high level since late December. in Ealing. I think one important point is that a lot of London, especially around North East London, went up much more quickly, and so in West London, and I think that's thought to be due to the new variant. And so at the moment, Ealing is actually highest in London, but we are seeing about a 20% decrease every week, which is really reassuring. But we are going down later than some other areas in London that peaked before us. So in the last week in Ealing, we had about 2,005 residents testing positive, and that's a rate in Ealing. At the peak in earlier in January, we were at a rate of about 1,100. So that is going down very quickly the last couple of weeks. Just wanted to share some data around inequality. It does show what's happening in the pandemic, that some of our more deprived and diverse communities are seeing a larger impact from COVID and have higher risk. Here on the second column, you can see, sorry, the third column, you can see compared to a rate of about 750 in Ealing, Southall has a rate of 1,139 compared to Ealing Broadway area, which is 491. You can see that almost all those areas are going down quite quickly, which is reassuring, but we are seeing those inequalities really heightened at the moment. Deaths, and you can see from the right, unfortunately, we are seeing lower rates than in the peak in spring, but spread over a longer amount of time. The infections and the number of people in hospital at the moment, that really is the kind of height of. However, because of the way the disease
you are coming. Sorry,
people,
Anna, you're coming
might
in.
become ill, might have to go into hospital.
You're coming in and out quite a bit there, Anna. Yeah, you are coming in and out quite a bit. Our councillor is managing to follow this. I think it's a.
I can try and load up and. If you give me 1 second. Sorry, Chair, give me 1 second. I had it loaded on my other laptop. Apologies, my signal's not happy today. Can you hear me at all, Councillor Costigan?
Yeah, I can hear you.
All right, let me try and keep going for now, and if I can join on my other device, I will do. It might be a bit clearer.
Great.
So the death rate we are seeing increase, and we are likely to see that carrying on going up for the next week at least, unfortunately. And then I think there is a view that we are going to see it come down quite slowly. So we are going to see quite high numbers for a while. So if I move on, in terms of testing, if people do have symptoms, we've got various options locally. We've got 3 testing sites within the borough. Residents can also order kits to be at home, and they can also access sites in other boroughs, so for example Heathrow or Twickenham. If people don't have symptoms, we have introduced a community testing programme since the 11th of January. That's really focused on people who need to be out and about for work during the current lockdown, and people who live in those communities with a higher rate, or those who are at higher risk, for example, because of their occupation. We are encouraging people to get tested twice a week, and we have got 6 sites that launched on the 11th of January, and we've carried out around 12,000 tests now so far, and we are seeing about 2% of those people testing positive, which is about what we would expect. Our aim really is to treat this early phase as a pilot, learn from it, and really take forward something sustainable for the rest of 2021. And we are also trying to carry out pilots, for example, for our adult social care staff, so actually on site, and we're also looking at supporting some workplaces as well. There is some complexities that national government are rolling out a number of different testing programs. So, for example, in schools and care homes, and they will be rolling this out to larger businesses soon. Sorry, Councillor Costigan, if Anna Marie's there, I'm trying to get in, but it's under my son's name, under Nathaniel. So if she can let me in, that would be fab, and I'll try and join from there. Thank you.
The signal does seem to be better now, though.
Great, thank you. Great, thank you.
Sorry, I think with the two devices, it's causing an echoing problem.
Okay, sorry about that. That was exciting. Apologies.
It was.
Oh, apologies for the IT this evening. It's just my Wi-Fi signals. Let me just try and share the slides on here.
That's okay. It sounds much better, and
yeah.
I'm sure we can manage to hold on.
There we go.
Oh, it's Nathaniel.
I know. It's for his baby Zoom classes. Apologies. God, what a day. All right, so that was just really to go through the testing. I think it's just being aware that the community testing is quite a new area for us, and we're really wanting people to come there, especially those who are having to go out for work and are potentially at risk. So just wanted to run through a few key messages. These will be shared with the minutes of the meeting, so they've got links in there. But the key messages generally are about following the national lockdown rules, stay home as much as you can. If anybody has COVID symptoms, please do isolate at home and order a test as soon as possible. And anybody that does need to leave home for work, do come along to our free asymptomatic testing sites and access those. And I think really importantly to say support is available. So for example, if somebody's on benefits and needs to self-isolate and can't work during that time, there is support available through Ealing Together. And so the link is there, and we can share the phone number as well. So Councillor Costigan, if you can hear me okay, that's the end of my general update, and I'm going to move on to vaccinations. Do you want me to take questions at the end?
Yes, I think at the end, Anna.
Great, thank you. So just in terms of the vaccinations programme, I'm sure a lot of you will know some of this already. This is a very much a national programme. We've got two different vaccinations, the Pfizer and the AstraZeneca. They're both being given as 2 doses 12 weeks apart, and that's really to ensure that as many vulnerable people can be protected as quickly as possible. There are 9 priority groups that have been set by the national government, and that's based on scientific advice. And the focus at the moment is very much on preventing deaths and more severe illness, which might mean that people need to go into hospital. So between just before Christmas, when the programme started, and mid-February, the government is intending to vaccinate or offer a vaccination to everybody who lives in a care home, everybody who's over 70, those who are in the clinically extremely vulnerable population, so who would have been shielding back in the spring, and to frontline health and social care workers. And after that, there will be a number of different phases, which essentially vaccinates everybody who's over 50 and adults with underlying health conditions, so those who would usually have a flu vaccine every year. And we've been working with staff and partner services to clarify who will be eligible as the frontline social care workers in this current phase. After those phases have been, everybody's been invited, that will probably take us to early summer. The priority groups then are, we are waiting for that confirmation from national government what that will look like. You will have seen a lot in the media recently about lobbying for different types of occupations who absolutely need to have the vaccine, and we would really support that. I think it's just a question of timing at the moment. So that could involve military, teachers and other public servants. The aim from the government is to vaccinate all adults later in the year. So probably by the autumn, most adults will have received an invitation. So locally, the council's been working really positively with our NHS partners on this. It's the NHS lead with our support there, and particularly around identifying, setting up and managing sites. So the two main sites in Ealing that we have are being led by our GP practice staff, and that's Ealing Town Hall and Dominion Centre in Southall. Ealing residents also have a number of other options. Some residents are already being invited to a large vaccination centre in Wembley, and we're opening a slightly smaller mass vaccination centre in central Ealing, just quite near the town hall. That's opening next week on 2nd of February. And we've also got one community pharmacy up and running at the moment, and I think 3 others starting quite soon. The GPs have been doing amazing work doing an outreach programme to care homes, and at the moment they are also going out and vaccinating housebound patients who are over 80. And there is a discussion that's just starting that hopefully in a future phase we will be able to look at opportunities for more of a community outreach model, so really trying to reach people who might not otherwise engage. So just to share some early data on progress, the 2 main sites have given over 18,000 doses so far, which is amazing in a kind of 3 or 4 week period. We've had about 900 care home residents and about 650 care home staff vaccinated, which is about 75% of residents and roughly around 40% of care home staff. So that's really great progress, and they visited all care homes in the last few days, apart from one that had a difficult outbreak. Everybody who's in the over 80s and housebound group is on track to be vaccinated in the next couple of days. And we've also had a large number of our social care staff who have booked for vaccinations at Wembley. And then just to say, anybody who's in the over 70s age group is in the kind of next priority group. Invites should be going out in the next week or so. So I think a really important aspect of vaccinations, and something that lots of different teams across the council are really getting involved in, is around inequalities and supporting people to take up the vaccine and to have that conversation with people about what are their concerns, what are they seeing as barriers, and how can we help get out those key messages. So there's a lot of evidence already from other vaccination programmes. So for example, the flu vaccination programme every year, and that's both nationally and in North West London. So we always see a higher uptake among those in the older age groups, and we see a lower uptake among people with health conditions, health and care workers, frontline staff, certain BAME ethnic groups, and the more deprived communities. And in terms of vaccine uptake and vaccine hesitancy, you do see a lot of different factors underpinning why people might be concerned. And this isn't just about the COVID vaccine. So there's a bit of complacency as, oh, it's not that serious, I'm not likely to get it. Confidence in terms of the safety of the vaccine, which I think is particularly important with the COVID vaccine and the speed it's being rolled out. How convenient it is, so just even basic things about, can I park at the site, can I get there, am I going to be working on that day? And then really crucial is about misinformation and how people are getting the information that they are. So we've done, we already have done, and we're in the process of listening to and learning from communities and really trying to have that two-way conversation. So we've got insights from both Ealing and North West London. So for example, we've been carrying out some community engagement task groups this month. We've also been engaging with our own staff, looking at what's on local social media, and our Health Watch colleagues across North West London have carried out a survey as well. I think a really important point for this panel is that early data about vaccine uptake in Ealing and North West London does really show those local discrepancies in uptake, especially by ethnicity and by deprivation. So for example, in terms of ethnicity, we're seeing much lower uptake among Black and Black British ethnic groups. And I think a really stark difference between people from different communities in terms of deprivation. So in Ealing at the moment, it's still early data, but in terms of the uptake, we're seeing maybe about 8% people we're seeing about 8% uptake at the moment from people who are in the least deprived groups compared to 4% in the most deprived groups. So that's, you know, you can see that's double the difference there, and so that's something we'd expect from other vaccines, but it's something that is really playing out at the moment with the COVID vaccine. We are seeing vaccine hesitancy when we're gaining insight around Ealing from more deprived communities, people from the Black and Black British ethnic groups, and also East European ethnic groups. Some of the information there we're understanding. So, for example, some feedback, especially among staff, in terms of Black ethnic groups, is around general trust in the medical system, for example, and worries about the speed at which the vaccines was rolled out. East European ethnic groups at the moment we're not clear on, and that's something we're really looking into. So if anybody has insights there, that would be great. I think really importantly for the panel is that a lot of these groups are the ones who are most at risk of serious impacts from COVID, whether that's economically or whether that's actually from an illness and hospitalizations point of view. I think we're getting a bit of a double whammy of inequalities there, and that is a concern here. I think one really positive point is that in Ealing and other vaccination sites, for those that do choose to get vaccinated from whatever background, there is a largely positive experience, and I've been hearing that myself when I was at the North Alt Task Group the other night. You are hearing people with good news stories, and I think there's an opportunity to share those more, and that's something we're working on. So just to run through some examples of concerns that we're hearing from local conversations, and you'll hear these nationally as well. There's a lot of myths out there about people thinking the vaccine might make them infertile or might have long-term side effects. Vaccines come out far too quickly and not sure it's safe. Conspiracy theories about the vaccine containing a microchip. Worries about there being meat products in there. And how's my data being used? Are the vaccine centres safe to go to? Is there enough social distancing? Overall mistrust of the health system, and some people just not having enough or feeling that they don't have enough information to make a decision. So it's really wide ranging. You will see some of these played out differently in different groups of people, but overall there's a lot of different concerns there. So just running through in terms of what we are doing here in Ealing. In terms of the communications, this is led by the NHS centrally, and we're really supporting and amplifying those locally. I think the key message for us that we're trying to share is you don't have to contact anybody. If you are eligible, you will receive a letter or phone call from the NHS. So really just wait for that to come. We're trying to do a lot of work both universally but also targeted to engage with those least likely to take up the vaccine, and really trying to use those community advocates and community champions out there. We're going to be sending out a letter to all residents in the next few weeks to provide messages about the vaccination as well as other COVID programmes. And we're also doing a lot of internal communications. We've obviously got a large staff group ourselves and in the providers that we commission. So there's a lot of communications there, and trying to build on the London messaging that's going on to encourage that uptake and to try and do some myth busting. In terms of more the community engagement side, I think this is absolutely key for the vaccine programme. I think excellent communications is key, but actually having a dialogue around this and being able to answer questions and hear from people is really important. We are in the process last week and this week of running our 4 community engagement task groups on COVID with the focus on vaccines. I was at the North Alt one the other night with the chair. I think they're running really well. I think unfortunately there's not that many community representatives at them this time for some reason, which is a bit of a shame, but it is only one aspect of our engagement. We are trying to gather those more qualitative insights from a number of sources, and we are trying to seek volunteers to help with our kind of social media work. So if people are going out and getting the vaccine or want to share a story about it, we're trying to encourage that. We're particularly doing some messaging and engagement with older people, given that they're the current priority group, and carrying out a number of sessions with care home managers and staff. And we're also carrying out our voluntary sector programme led by Each, who are trying to do some more of the grassroots engagement. So really training up staff to go out and have those conversations. And just to say, we are developing a comprehensive plan around this so that we know what we're, trying to pull it all together for the next few weeks and months. At the moment, trying to focus on understanding those issues, developing this engagement plan that will be both universal and targeted, and really trying to have some easy to read or visual assets that we can use and that are in different languages. Trying to carry out that community engagement in a very targeted way. So trying to train up people who are out there in the community who are influencers to try and deliver those key messages so that they get out quite widely to the community. We're also considering whether it would be helpful to have some sort of wider community conversation type events with residents, and we're also doing something similar with staff. As the data builds up over time, we are going to, it will get better and better, and we will be able to use it to target that community engagement even more precisely. For example, that will give us some discussions and points to use when we are trying to plan some future community outreach models. So just finally, Chair, key messages around vaccinations. We are focusing on those priority groups at the moment. We have got a number of FAQs, and we've got some useful links on there with some videos. So we will be sharing that very widely. You will get an invite for vaccines, so don't worry about calling anybody. We need everyone to take up the 2 doses. And I think importantly at the moment, given that we're not sure when the lockdown restrictions will be lifted, even if you've had the vaccine, please carry on staying safe and keeping yourself safe and your family and friends. And I think importantly as well, we've got information and videos about what actually happens at a vaccine centre, what it looks like, so that if anybody is particularly worried, especially those in the more vulnerable groups, they can see what happens there. So, Chair, I think that was all I was going to say. Thank you for listening, and happy to take any questions.
Great, thanks very much, Anna. Perhaps you could just unshare your screen,
Yeah.
and then I'll be able to see if. So I've got one question already. So if anybody else has a question, either use the hands up function if you can find it, or if not, just put it in the chat, as Councillor Pada has already done. So I'll call on Councillor Pada first, and anybody else, just let me know if you've got a question.
Yes, thank you, Chair. I've got really good, a positive message to pass on. I had my vaccination done on Monday. It was really good experience there. They're very efficient. The health workers there, they were very, very efficient. You go there, my appointment was 12:30. At 12:40, I was out of there. It's so good. And the social distancing, there's nothing to worry about. It's they make sure that you're socially distanced, you're kept socially distanced. That's how good they are.
Right.
Yeah. And on the other side of it, it's on the communication. I think there's a lot of myth about this, as we have already been mentioned. This vaccines hasn't been tested properly. It's been rushed through. These sort of comments been made, but I think there's nothing to worry about. What we can suggest is, if we can use like for Southall, we can see that it's Southall is one of the worst areas hit. If we can use like media like Desi Radio, it's very commonly used. It's almost everybody listens to it. It's Punjabi speaking, and you know that in Southall, most of residents speak Punjabi, whether they're Indian or Pakistani, most of them speak Punjabi. So Desi Radio is very well listened. I think that's my suggestion. Yes, thank you.
Right. Thank you, Councillor Pada. Is there any other members of the panel who have questions? Because I'll just take a few, and then I know the Cabinet member wants to come in as well. But yeah, Councillor Steed, and if anyone else can either physically put up their hand if their camera is on, or I've got Councillor Donnelly as well. So I'll take Councillor Steed and then Councillor Donnelly. Yeah.
Thank you, Councillor. Anna, the comment about the community engagement meetings, these I'm assuming are online meetings. Have you got any dates for these yet, or is that to be confirmed?
Yeah, so thanks, Councillor Steve. So
I'll bring you in a second, Anna.
Okay.
If we just take three, sorry. And Councillor Donnelly.
Yes, a couple of points. Firstly, I mean, relating to the levels of infection, and particularly, you know, I think we've seen alarming levels clearly in Southall in particular. We've also seen extrapolating how much improved treatment appears to be in terms of the relative number of fatalities in December, January compared with back in March and April. But the numbers of infections are way above what we had back then. Do we think we understand why things have got so serious, particularly in somewhere like Southall? And the other, unconnected, we were reading at the weekend, I think, about the vaccination champions and the money that some authorities have been given, partly to do this work that we've just been talking about. And I know both Brent and Harrow got pretty substantial sums of money, well in the hundreds of thousands. And I'm just surprised, given that we have the same, you know, in some areas we've got very concentrated examples of the same issues that they got in Brent and Harrow. Why do we think that we were not picked out to receive any of that money to help us do that work? Thanks, Chair.
Thanks, Councillor Donnelly. Yeah, Anna, do you want do you want to respond to those?
Yeah, thank you, Chair. Thanks for the questions. So in terms of DESI Radio, I absolutely agree with that. So I think we've already got some slots on there. And I think it is something we've used for other aspects of the COVID programme. And so definitely anything like that that we can think of, I think will be really, really useful to reach different communities. In terms of the dates of the meetings, Councillor Steve, so we've already had 3 of the 4 meetings. I think the Southall meeting might be later this week. They are only one way that we're trying to have these conversations. So I think if there are other groups that it would be useful for us to attend or to invite to future meetings, definitely do let us know. We have been running those groups for a few months now, and we I think just, I don't know why, but these ones just had a bit less uptake, which was a bit of a shame. But the minutes are shared and the actions are shared with the whole group. But we are looking at quite a wide range of different engagement opportunities. In terms of the community champions and the funding, Councillor Donnelly, I agree. Between us, we're not quite sure where the funding opportunities were there. I think some of the groups that were given funding for this do work across North West London. They're not just borough specific, so we are linking up with them to see if we can do some work in Ealing. We have, however, got there is other COVID money that's come from the government through a number of streams, and so we are carrying out different elements of communications and engagement through that work, as well as just through our usual teams work. So I think any opportunities like that we would be keen on in Ealing, but it's not stopping us from taking things forward. And we are talking about community champions, so even if it's not a formal programme that we have up and running, we've got all the community representatives that do attend our task groups. We've got volunteers through Ealing Together that I think we'll try and work with as well, and especially councillors being out there in the community, which is one of the reasons I wanted to share those key messages tonight. Thank you.
Chair, the question about why we think Southall in particular developed such a high incidence of infection.
Sorry, Councillor Donnelly, apologies. I think there's a lot of different factors. We've had this discussion and queries about that all the way through the pandemic. I think Southall, along with a lot of other communities in Ealing, there's a real mix of risk factors. So when you look at the risk factors for COVID, people living in urban areas and particularly more crowded household situations, people who are living in more deprived circumstances, ethnic groups, certain ethnic groups, especially South Asian nationally, seem to be affected more. people who are in certain frontline occupations. So, for example, taxi drivers or people who work in shops or frontline care workers, and people with long-term health conditions, especially things like diabetes. We have got higher rates of those in a large areas of Ealing, especially somewhere like Southall. So when you add these all together, you can see why Ealing does, is at the higher end in some parts of the earth. So, for example, at the moment, Ealing, Brent, Hounslow are at that higher end. We were the same back in the autumn. I think there's a lot of different risk factors that come together that mean that Ealing does have some of those high risk factors, and especially some of our communities like Southall. Over the last few months, we've done a huge amount of targeted work in those areas, so especially Southall, Northall, Acton and Greenford, and we are carrying on doing that. But those rates in Southall are a particular concern at the moment.
Right. I can't see any further hands up or in the chat. So I think Councillor Rye wanted to jump in as the Cabinet member. Councillor Rye, are you still there? Can you hear me?
Yes, I can.
Yeah. Would you like to jump in with some points?
Thank you. I just wanted to thank Councillor Padder for his feedback, which is really useful. And as a member of the Southall community, I think we can use him as a really good example. So do make contact with me and we'll see whether we can take that communication work forward. So thank you for that. The other point I wanted to make is I think Anna has answered most of the questions that Councillor Donnelly has asked, but another factor is multi-generational households. And we know that in that area, there are a large number of multi-generational households. So that adds to the risk factors. And if we can now get we know that a lot of the Asian community can be persuaded to take the vaccine, whereas amongst the Black community, there is more hesitancy because they're more determined not to have it. So I think we can work on getting the uptake and resolving that. And as as Anna has said already, we will be continuing to do the championship work with our boroughs, our neighbouring boroughs as well. So we want to speak to the community in the voice that they want to be spoken to. So that's a big piece of work that will kind of run parallel with the vaccination programme. Thank you, Chair.
Thank you, Councillor Roy. Just a couple of things to pick up on there, Anna. I just wanted to check. I know you said that we're looking at kind of myth busting, and there's a link in your presentation there to the Ealing Council site, which I did have a look at, and it has got some helpful myth busting on there. Like you say, I'm vegetarian, and it actually does go through that it is vegetarian and there's not meat product in it, for example. But given that a lot of the misinformation on this is being spread on WhatsApp and various bits of social media, is there a way that the council can look at putting that myth busting stuff into an easily shareable format, so like a sort of a graphic type thing that people can share on WhatsApp? I know Councillor Mahmood is great at his WhatsApp groups, so and many of us are living on WhatsApp groups these days. So I wonder if perhaps the council and comms could look at making those more bite-sized and easily shareable, rather than just going to a website, which people don't tend to do that often. The other thing was, coming back on Councillor Padda's remarks about his experience. I absolutely, I think the Desai Radio is definitely something that we should include as a, and I'm glad to hear the councillor already doing some of that. But I noticed some other boroughs are using councillors to do little videos, and particularly councillors from Black, Asian and minority ethnic backgrounds, explaining that they've had the vaccination. So I wonder if we can get Councillor Padda to do a little video, and if we could encourage other councillors to, particularly, as I say, from BAME backgrounds, to do little videos that we could put, we can put out on WhatsApp groups and on some of the Facebook groups that we're all involved in. Because I know you said, Anna, that councillors are out and about in the community, but we're not out and about in the community these days at all. We can't be, so we're reliant again on the social media. So I wonder if we could try and use the resources that we've got there. And I think just two other points. One was, Councillor Donnelly's point about these vaccination champions, I just want to check, did we actually apply for any of that money? Did we apply or not? Because I think you had to have a plan. You could only apply if you had a plan, and was there a reason we didn't apply? And the second one is a really basic question, but it's been asked by a few residents. Parking. I understand now that there is parking for the town hall site, and I just wanted to check, is there parking for the Dominion Centre site? Because a lot of older people, I find, they're bothered much more about whether there's free parking than whether they're going to get the vaccination or not. So I wonder if you could just respond to those, Anna. Thanks.
Yeah, thank you, Chair. So in terms of social media, absolutely. So our communications team are out there trying to do very witty things. They are trying to talk to community influencers who are already using social media. So for example, Instagram or TikTok, on WhatsApp groups. So really trying to share those things at a local level. They also have developed some key messages around vaccinations as well as other aspects of the COVID programme. And so they are trying to share those. So for example, they might just be a very short line that somebody could share in a WhatsApp group or in Twitter. And they are also doing some targeted work around Facebook. You are able to target messages depending on where people live or certain demographics. So a lot of that is in hand, but I absolutely agree. Everybody lives on WhatsApp and everything else at the moment. So anything we can get out that's short and shareable, I think is really important. We've also, a couple of months ago, the part of our website that does have our communications asset on it, so different leaflets and pictures and diagrams, they have put everything on there that people can share. So for example, if there's people in a community group or voluntary group, they are able to use them and share them with their group, or for example in faith settings, and that is available in lots of different languages as well. In terms of making use of counsellors, I think that would be amazing. I think there have been some individual conversations, but anything we can do about that would be great. So I will pick up that with our communications and democratic services team. In terms of the community champions, as far as I'm aware, it wasn't something we were asked to bid for. I think it was a little while ago, and it's not something that we made a conscious decision to not bid for. So we're not sure if it was targeted at certain boroughs for some reason. But again, we are looking at options to do that kind of work in any case. And finally, parking. I've had so many queries about this, and I absolutely appreciate it's a tricky one, especially if it's somewhere that you don't know and if you've been staying at home for so long. There is information on our website, and I can send that link round. And GP practices are sharing that information when they talk to people as well, both in terms of what parking is available at both sites. So there is parking at Featherstone Terrace car park, for example, and there are some disabled bays at both sites, and some drop-off points as well. And also if people don't have someone that could take them, for example, you are able to access Ealing community transport. So it really just is, again, it's a message of talk to your GP practice if you have concerns or queries about your appointment time or about the location or any travel worries. Definitely talk to your GP, but it's also on our website as well. Thank you.
Great, thanks. I don't think we've got any further questions. Is that right? I don't see any hands up. So thank you very much for that, Anna. And I think our thanks as a panel as well for all the work that you and your team are doing. This is obviously really, really vital work, and it's our way out of the pandemic, isn't it? So thanks so much for everything you guys are doing, and also thanks to Nathaniel for sharing his computer with us. That was much better.
Thank you.
Right.
Thanks, everybody.
Thanks very much.
Thank you.
Okay, we're now going to move on to item 7. And item 7 is the impact of COVID on Ealing Council services and staff. So this is looking particularly at sort of our customer-facing services, our resident-facing services, and also how our staff are, changing the way they're working in the pandemic. So we've got, I think, 3 officers that are going to give us quick presentations in this section, and we're going to do it it in the order of, we're going to take Allison Reynolds first of all, and Allison is the Director of Customer Services. Once we've had Allison, we'll then do Liz Childs who's Director of HR, and she's going to particularly look at the wellbeing survey that we recently did. And then Ed Axe, who is the Director of ICT, will talk a little bit about ICT and home working in that aspect. So what I'll do is we'll take the three of them and then we'll have questions, if that's okay. So if councillors could just kind of jot down if they've got a question, so they remember it, and then we'll take the questions at the end of the three. I hope that's okay. So if we start with Allison, do you want to take over, Allison? I'm just checking if Allison's out there. I can't quite see her. Oh yes, I do see Allison. Yes, Allison, calling Allison, can you hear us? Not quite yet. So Allison is sharing her screen. We can't quite hear you, Allison. I don't know if you're on mute still.
Sorry, I'm just coming off
Perfect.
mute now. So can you see my presentation?
Yeah, and if you just click the start presentation button at the top, then we'll be able to see it a little bit better.
For some reason I've lost my whole screen. Let me go back. So is it at the top there?
Yeah, but at the brown ribbon at the very top, there's something that looks like a screen. There's a little white icon. It's kind of like a it's like a display screen.
On your screen, Alison, not the main screen, on your presentation screen.
Yeah, I'm just looking at that. Hold on. Sorry.
Or just click slideshow.
Oh, yeah, no, that's fine. Yeah. So sorry, has it moved?
Yeah, yes. But if you move up the top to where the brown ribbon is, move up the very top where the brown ribbon is.
Yeah.
Up a bit further, because I can see your cursor. If you go right up the top where there's a brown ribbon.
Yeah.
Further.
Oh,
keep moving up.
Alison, hit slideshow and then start slideshow. And the white.
Yeah, that one there, you got it. You're literally on it. Click it now. Yeah, perfect.
Right. Okay. Sorry about that. I'm new to Zoom. I'm used to Teams. So this is, I'll just a few slides really, just to talk about the customer service response to COVID. So the majority of staff in March, at the start of the pandemic, we managed to move most of our staff to working from home, which was quite a task because it was a significant amount of people, and thanks to Ed's team for helping us do that. And that included the contact centre, which initially we did have some technical issues and it took us a good few weeks to get there, but we're managing a good stable service provision now with all of our contact centre staff bar a couple working from home. We closed the Percival House face-to-face service completely, with all services moved to telephone or online, and all of the staff that were working in the customer service centre were redeployed into new roles within customer services to help with our response. So some of those were to deal with the additional demand because the customer service centre had closed. We've had quite a significant increase in demand in the adult services contact centre and the referrals there. We were also tasked with doing the outbound calling for our shielding customers, and we also opened the Ealing Together contact line. So all of the staff within customer services were sort of we reviewed all of their skills and moved around appropriately to help support our response to the pandemic. So we have a few exceptions to working from home that continue, and just to give you some examples, we still have to scan documents, for example, if people are submitting evidence, although we have moved quite a significant number of customers to scanning in their own documents through their own devices and sending into the council, and we still are processing checks. We've got in housing demand, which was quite a high demand on face-to-face services. we now have staff delivering telephone assessment services, which were once delivered entirely via face-to-face in Percival House. This has had a really positive impact on the housing service. They're now able to do same-day assessments. They've got up to 20 staff available to speak to customers and to process cases, and they've got significant improved waiting times and customer satisfaction, and the outcomes for customers are much improved with much improved homelessness prevention. And I've just put in a note here, and this is from Lynn Duval, which shows that actually the number of approaches that we've had from singles compared to last year were 7%, but the positive prevention outcomes have increased by 18%, which is a really good improvement. We've had family approaches have fell over this period, but this is mainly due partly due to the fact that there would be no evictions at this point, but the number of positive and relief outcomes have increased by 7%, so that shows that we've got a higher number of cases being successfully prevented through the COVID period. So the Ealing Together team, as I've said, has evolved, was set up, but it's now evolved in its provision of advice and support. And the team now deals with a wide range of inquiries and issues. And it's, as I said, made up with staff from customer services. We deal with self-isolation payments. We've been getting inquiries regarding vaccinations, testing centres, financial support, food bank inquiries, local welfare. So we've really had to be able to respond to what the demand of the customer is and how that's changed over this period. We've also, that team, supported by some of our face-to-face staff, did proactively telephone 22,000 socially shielded residents in wave 1, and we're continuing to recontact and contact some of our most vulnerable clients at the moment, since the move into tier 4 and then lockdown. So we've gone back over that list and we're recontacting customers and also contacting anyone else that we're made aware of. So it's a wraparound telephone service that we're now providing, and just on this slide it just shows the type of calls that we're dealing with. Just to say that my team, customer services, we've also managed the COVID winter support grants and issued all of those. We dealt with the applications in the October half term for free school meal provision, and we set up the voucher scheme for free school meals over the Christmas holiday, and we're just preparing vouchers to go out for support over the next half-term holiday. So the teams in customer services have been working hard to support our residents in all areas. Just some of the impacts of COVID, we've seen a 30% increase in workload, particularly in benefits and council tax support. It's a 30% increase. Also increases in local welfare. We used to issue payments for people in crisis via payment cards. We now make those payments direct to bank accounts. We're processing self-isolation payments. We've had over 3,000 applications. These are all received online, and we do provide telephone assistance, but we are struggling to keep up with demand, and we have just recruited some additional staff to help us to manage the volumes. What I would say is that we do need to do a bit more communication about who is entitled to this payment, as we are rejecting a significant amount of applications due to the fact that people don't qualify for these, and then that holds up the issuing of payments for people who are entitled. I've talked about winter support grants, so I'll move on. Another key change just to talk about really is our registration service. So this has always traditionally been a face-to-face service. So at the start of the pandemic, we were able to move our registration service to a telephone service only, which has helped us significantly. The team have worked very hard, as you know, over the period to register the deaths of our people who die in the borough, not necessarily all residents, because it's registration of people who die in the borough. So and we've managed to offer appointments as far as I know without any delays to make sure that that's a speedy process. And we're expecting that will continue, and we will continue to do that over the phone rather than face to face. And we have been offering face to face individual private appointments for citizenships, but they've been suspended at the moment due to the fact that we need to push all of our staff to deal with death registrations, which are currently high. So looking forward, this has enabled us to look at our service delivery and how we can work differently. What we have found is that home working has helped us focus on improving staff and service performance. And what we found in some areas that we've been able to process and become more efficient and use more in automation, which is a much better outcome for the customer, particularly when providing financial support. Our staff have been very flexible. They've adapted well to change and are very willing to move quickly to provide services depending on changes due to the pandemic. And we've gone live with the new customer portal a year ago, and we're slowly adding services there, which also helps our customers to log inquiries, service requests, and then track their complaints and inquiries. And then we've also just the benefits of cross-service working, which we found has really helped us to deliver a much better service to our customers in the current environment. I've just talked about the customer portal, so I won't talk about that again, but that just shows the number of customers that have now registered, 93,000, and these are the services that are currently available. And then just on another note, from a customer service point of view, we do recognise that not everybody has access to digital or the skills or ability to interact with us online. So we're currently working with a charity called Citizens Online, who are helping us to improve our knowledge of our customer base and build an evidence base for some digital inclusion work where we can access some of our hard to reach customers, help increase the confidence of those customers using digital channels, and also help the confidence of staff and volunteers to also help our customers access digital. So this is a project that's just started, so I'll be happy to update probably in a few months on how we're progressing with that and the information that we've managed to gather. And I think I'll stop there.
Great. Thanks for that. And we're going to now just quickly go over to Liz Childs, who is Director of HR. And like I say, if you've got questions, just hold on to them, but put in the chat or stick your hand up if you want to ask a question once we've finished with these three presentations. So Liz, do you want to take it away?
Yeah, I'm just finding the right, I've got a number of documents open. I just want to share the right screen with you. So hopefully that will arrive. Can you see that?
Yep, wellbeing survey. Yep, looks right.
Great. I had it all lined up after I had the advantage on Alison of having it ready this one. So I've got a couple of PowerPoints, but you'll be pleased to know I'm not going to take you through every single slide on these. Before I just get into this one, in terms of sort of setting the scene, the majority of the workforce has been working at home since March, although clearly we have some staff that haven't worked at home because their services can't be delivered there. But I just wanted to touch on Pep Sickness Absence, which I think is a quite important issue to mention, although there's not a slide on it here. So when I ran the figures today, COVID absence, so this is staff who had confirmed COVID. We've had 142 staff so far with confirmed COVID. And I think what's interesting to note is that in 2020, so from March to December, we had 56 members of staff with COVID, but since January, since our return in this new year, we've had a further 86 staff who've had confirmed symptoms. So I think that overall our sickness absence has been down, and I think we can put that as a result of lots of people working at home and managing their well-being in different ways. So overall sickness absence is down, but obviously COVID is accounting for quite a lot of sickness absence. And also the numbers are different though. So suspected cases in 2020, 176 staff had suspected COVID. And in 2021 so far, it's only 13. So I think we've got a lot of staff being tested and, you know, getting out there, getting their testing, and they are testing positive. And the pattern appears to be staff that are predominantly more out and about. I think we have had an impact of the Christmas relaxation of rules. So we certainly had some staff that didn't catch it in a work-related environment, as I'll describe it. That was Christmas for us, as most people were not working at Christmas, but I think probably important to note that in terms of where we are. So I'm not going to go through all these slides, but staff wellbeing, we've done 3 surveys so far. Last one was back in November, end of October, November. And the 4th survey we've just done is about working locations, but also includes some stuff on wellbeing. So I might just refer to a couple of slides on that in a moment. So we had a good response in terms of staff wellbeing. 953 people responded. And I'll just flick onto this slide. So on the 9th of, this was the results on the 9th of October. So obviously, in terms of the 3rd survey, people get more anxious. Again, this is the green bar here about mixed emotions. So clearly well-being and mixed emotions situation going up there in the latest survey, a bit of a peak on that. Then if I go to the next one about what concerns people most, again, an increase about the health and well-being of loved ones, as many of our staff have had loved ones, families, friends and relatives impacted by this. I won't focus on that one. So I'm just going to take you to this slide, because this is about some of the things people were saying in terms of the free text statements about better collaboration. So there were lots of examples of some good things, you know, the take time of pool sessions, departmental updates, all those sorts of things going on. But we recognised, you know, that there was more to be done. So lots of good practice on that, and hopefully you've had a time to have a look at that. But in terms of the emergent themes from this, we have been encouraging managers to increase their level of contact and on an individual and team basis, and encourage where possible more face-to-face interactions. And some of those are making sure people have their cameras on Teams, because physically, obviously, it's difficult for some people to meet at the moment. And part of that individual contact has been that we've been working on making sure everyone has individual COVID-19 risk assessments. So part of corporate health and safety sits with me, and part of our work across this has been to make sure risk assessments are being done for individuals, and that helps encourage that conversation about well-being and just those general conversations about people's circumstances. Team discussions has been really important, and we've been encouraging people, and there's lots of evidence that's happening. Drop-ins to departmental meetings, some of those have been going on as well, and managing people's increasing workloads and its impact. So we've been actively encouraging through the work Paul's done and the communications we've got out, that it's important, although there might not be anywhere to go at the moment or anywhere of interest, people need to look after their well-being, and they need to take their holiday. And that's actually going to be a big drive across not just Ealing but London councils generally, because lots of people are accruing lots of leave and people really do need to take some breaks now. We've looked at improving cross-departmental working. I think Alison's already mentioned this, but there's lots of cross-departmental working going on, and my team in particular, working with Ed's ICT and FM team, have met every week to deal with things from risk assessments to individuals and buildings and well-being. So there's been quite a lot of departmental working. And we've continued to promote everything during Teams meetings and appraisal conversations on one space. So some of the next steps, we've signposted people to the Managers Toolkit, which is a big piece of work and learning we did with managers back last year. and the mental health and wellbeing resources, and to make sure that people, you know, people that don't like accessing one space, and that we quite often now attach these as documents to all the things we're sending out. So what else can we do? This is our challenge to ourselves before Christmas: the annual leave, regular breaks, lunchtime. So we've been really proactive on that. And the other thing in terms of regular breaks is that led by Ed and the ICT team, when you book an appointment in Microsoft or Teams now, you'll find it doesn't give you the full half hour as the default or hour. So it's to make sure people have got time to go and get a cup of tea. So hopefully that's helping people as well. There was a suggestion about 2 hours off for Christmas lunch, but actually we ended up, as probably councillors are aware, giving an additional day's leave on Christmas Eve for all staff, and those staff that couldn't take it on Christmas Eve have got to the end of March to take that opportunity up as well. There were quite a lot of pre-Christmas get-togethers online, and talking to people, you know, picking the phone up and talking to people, don't send so many emails. So I'm just, if it's all right, going to just flick to a few slides on the other PowerPoint, so with any luck. If you can just let me know that you've got the working locations one now. Is that showing for everybody?
Not quite yet.
Okay, well, if I just talk through it while we're waiting for it to pop up. So we didn't do a wellbeing survey just before Christmas. We decided to do a working location survey. Two reasons for this were that the plans to do the redevelopment of the Percival House site, but also to find out really how are people finding working at home, and Alison's already referred to that. I don't know if it's come up yet, and I think probably my screen's, I'm going to stop sharing because I think my screen's frozen now.
Yeah, I think sometimes you have to stop the sharing and then do it again to put a different.
Yeah, hold on a minute. Sorry about this. We were nearly there. Let's share the screen, see if we can pick it up again.
It's okay. This is what this way of working is all about, isn't it?
I thought I got it cracked tonight, but yeah. Let's see.
Don't worry, Liz, it'll be an ICT problem.
Yeah, as long as you don't share your holiday snaps or something like that, you know.
Hang on, we should be going. It looks like it's going live now.
Yeah, we've got something. Yeah.
Perfect.
Yeah.
Oh, right. You'll be pleased to know I'm not going to go through all the slides. So if I just pick out some highlights there. So the working location survey was really to get some feel for what's it like working at home and beyond COVID. So this was not about the actual development of the building, but it's beyond COVID. You know, people have been working at home for such a long time now. What are their plans over the longer term, given options given to them? So we've got a great response. We got 1,200 staff responded to this, and I'm just going to flick through to what is my slide 5, hopefully. So the significance of this slide is before COVID, 83% of staff said the majority of their working time was normally spent in the office or at a council building, whereas after COVID, only 19% of staff are saying that. So, and 70% of staff are expecting the majority of their working time will normally be spent working from home. So a massive shift in terms of what people were thinking in terms of the future. I'm not going to go through all that in detail. So I think what's quite interesting is we ask people, when you come into an office-based environment going forward, what is it you really want? So use of a desk or workstation alongside their team is really, really important. 69% of people were saying that. Slightly bizarrely, perhaps, access to a printer was seen as most important after that. So we haven't obviously quite got the digital paperless message across about people needing to print items. So we've got to drill down into that. So I'm not really sure what that's about. Meeting rooms, which I think many of the directors and services thought were going to be really important to people, seem less important to the workforce. And when they come in, they want smaller meeting rooms. And I think behind that is, you know, if you're going to be in Teams meetings with other colleagues or, you know, catching up one-to-ones, that was really important to people. So some themes that came out. So we had some free texts themes. So what we've tried to do is distill down 500 comments about what's going well. So I think some really positive things: travel time, minimising travel time, work-life balance, more flexibility, more productive, efficient in their role, less distractions and noise. I don't think that's probably true for all staff, because we know many of our staff are juggling caring responsibilities for children at home at the moment, both pre and school age and university children at home at the moment as well. So people are saying they've adapted to working from home, it works, they've become more paperless and it's the new norm. So lots of good comments from that. So a few people are saying that their struggle with working at home is because their home environment. So we do have staff that work in bed sits or multi-generational households where they just don't have the room to work at home, and some of those staff have actually come back in. And their ICT issues are not to do with, occasionally it's with their hardware, sometimes it's operator problems, but also their home broadband. And I know we've tried to give people quite a lot of support on that. But probably most importantly, in the themes that's really coming out now, people are missing the human contact with others in their team. And when we talk to people about this, they said, I just want to come together with the team, do a bit of sharing, bit of shared learning, and work together again. So, I'm not going to go through all this because I'm conscious of time and Ed's opportunity to speak. Meeting face to face. You can't beat meeting face to face with colleagues. So that's definitely one of the themes that's coming out. 2 emerging themes for delivery of services going forward. There's a group of services comfortable with working from home either for the majority of time or coming into the office when they need to. And then those services that are delivered on a daily basis to residents and businesses, they need touchdown space going forward. So I think we've got sort of 2 groups of staff we're looking at in terms of our models of working going forward. And requirements for people, we talked about the meeting rooms, hot desks. I'm not going to talk about those. Around the ICT, some positive news is Microsoft Teams, which is great because we've been doing lots of training on that, and I think we've seen a massive improvement in the way people have used their technology over this period of time. And we still got some work to do on people that took their services home but haven't taken the opportunity up. Ed will be able to touch on this, but many staff did take home screens, keyboards, mice, and chairs to help equip them working at home. And but obviously for some people that's still a bit of a challenge. And in terms of potentially the Decant and Percival House, there was some information. So we haven't said, we just said obviously there's a Percival House project, people know about that, and a lot of feeling coming through about people not wanting to work on a building site if that was the option that we were going for. And yeah, so I think that's probably where I'm going to stop on this, if that's all right. I'll just stop sharing that one for a moment.
Great. Thanks for that, Liz. That was massively interesting. Actually, there's loads in it, but I'm going to quickly move on to Ed Axe, so he can put. Great, you're already sharing, brilliant. That's the IT man for you. And then, as I say, councillors, hang on to your questions. Okay, go ahead, Ed.
Okay, thanks, and good evening, everybody. I will be brief. My team and I spent 2 years before COVID working out how we were going to get people to work at home. And then COVID hit us in March, early April, and we went from having about 2,000 people in the office with 100 working at home. It completely flipped the other way around. And we suddenly found we had to support 2,000 people, as I say, working from home almost overnight. Certainly within a week, this kind of happened. And it's, I'll be fair, it's not been without its challenges. We've had problems, but I think we tried to resolve a lot of them as we've gone along. And I'll talk about that a little bit more a bit later on. I would like to say, though, also in April, the ICT team were then asked, I was asked if I could set up the food distribution. If you remember at that time, we were doing food parcels as a council. We did many tens of thousands of food parcels. It was my team that set that up and enabled it. and physically. So we went from being a back office to a front office, actually delivering food parcels out to the people who needed it. And then when PPE became available, it was the ICT team who then stepped up and organised the PPE. And we're still delivering PPE, obviously now out. We do deliveries every day as an ICT team. So, you know, I would like to credit my team right at the start here for being, you know, very flexible, but like Alison had said earlier about her team. We also at that time then refitted Percival House to allow those people who needed to come in to be socially distanced. We set up a phone line for support for people. And all the time we were doing this, we were still delivering the usual projects that were essential, the gold projects of the council, the digital project, the data centre project, etc. And then more recently, it's been the ICT team who I got contacted on Christmas Eve to set up 6 testing centres, which we set up over Christmas and the New Year and got up and running on the 2nd week of January. And now we're running that. That involved 160 people over the 6 testing sites. It's my team that runs that. Just the COVID and talking specifically about ICT, we are under unprecedented attacks now, unscrupulous people, mainly from Russia and you know, those areas of the world. We see thousands of attempts on our system every single day. And our friends at Hackney obviously suffered an incident from which they're still suffering, where they suffered a ransomware attack. So we have always and continue now to work very closely with the Cabinet Office and the National Cyber Security Centre. You know, it would be an absolute disaster for anyone if we suffered the same as Hackney. And so we are introducing and have introduced further protective measures. And I'll keep saying the point all the way along the line. It's always an analysis of the risk against the likelihood of the impact, the mitigation versus the functionality. And you know, we do apply things in IT to try and keep our systems safe. But they do sometimes have an adverse effect on the functionality and the ease of use. But I would say, you know, we've also during this period, you know, we did manage to get Teams up and running. We did manage to get Zoom available to people when we could eventually get the licenses out of the vendor. But I think we've had far more success than we've had we've had many challenges, but far more success than failure. We have, as I said, we have changed our security. Most attacks come via email, not all, but many come via email. We've applied a lot more scrutiny to the emails coming in. We have had to restrict email on personal phones, and we've had to make changes to our website to try and keep the security on that as well. We are always following the advice of the National Security Centre. We're very close to them. Just before COVID hit, I organised an event for the new head of IT when he joined. We simulated an attack, and that has proved very worthwhile as a process. We learned a lot of lessons that we're now enabled. As I say, I keep repeating, it's a balance between the risk and trying to put stuff in place and the functionality and maintaining functionality for people. You know, as an IT person, to keep very safe, it'd be easy if nobody used it. But clearly, you know, trying to give functionality to people, but it is difficult. We are dealing with a range of skill sets when it comes to IT. A range of proficiency, and you know, we try to offer support. We do recognise that. We are also trying to offer our services across a range of devices, which makes it infinitely more difficult for IT. If we were just trying to, we test everything against the devices that we've given out to people, but You know, a lot of people want to use iPhones and iPads and all the rest of it, and it's very difficult for us just to you know, make sure everything works on those. It would be much easier for us if there was a standard device, but that's probably very unlikely. I've talked about the website. We did adjust policies on that to try and make the website more safe. And finally, I mean, COVID has been a huge challenge to us, but I do think we've risen as a council, and I'm very proud of the IT department and what they've done. I think they've been brilliant. And I just hope a lot of people agree with me. It has been very challenging, but I think we've done okay. I think that's me. Any questions from anybody for all three of us? I think it is, isn't it?
Yep, thanks very much for that, Ed. And we certainly, I'm sure we would echo your thanks to your team for the work they did around the delivery of food parcels and PPE in the same way as we would for Allison's team. And I'm sure the work that HR is doing as well with this massive change that we've seen in the council. So any questions for either of the three officers we've just had? If anyone just sticks their hand up or use the hands up function or put it in the chat. I've none so far. Any questions? Oh yeah, Councillor Pada, go for it.
Yeah, thank you, Chair. It's just a small question. It's well, I know we're encouraging staff to work from home. There are a couple of things that's come to mind on this. One, do they know that it's going to be increased cost, like permanently having heating on all day when they're at home? Obviously, that will increase the cost. And also, for someone like me, I can't work from home because I'll go mad sitting at home all day. I do like to meet people. So I think, have we taken all this into consideration? That's my question. Thank you.
Okay, anybody else got any questions? Because I'll ask them all in one go. Yeah, Councillor Sumner, go ahead, jump in.
I'm going to say, Councillor Paddy, you just need to get a photocopying machine. Everybody will come and talk to you then. That's what the photocopying machine's about. Sorry, a bit light-hearted.
No problem. Anyone else got any questions? I've got a couple of questions that just come in maybe in the back of that. One was probably for Liz. I think that you said, Liz, that there had been a decrease in people calling in sick. And I think because you said maybe they're managing their sickness while working from home. So I just wanted to ask, I know we're encouraging people to take their annual leave, but do you think we ought to be encouraging people to call in sick when they're sick rather than working through it just because they're at home? Because I think that might end up, you know, sort of being dangerous in the long run for people. Because I think that there is you know, people feel, oh, well, I don't have to go into work, so perhaps I can work through this sickness, but it's not always the right approach, is it? And I guess as a responsible employer, should we be, you know, encouraging people to actually, you know, take time off sick if they are sick? And the other thing also to do with the working from home, which Councillor Pada raised, is how we manage staff who are home working, because I think in some organisations there's an antipathy towards allowing staff to work from home because the organisations are, you know, quite focused on presenteeism and on, you know, feeling they can't trust staff to work from home. And part of what's needed maybe is for management to understand that managing staff at home is completely different, and you've got to look at sort of outcomes rather than, you know, how many hours did you sit in front of the computer. And are we looking at changing the way we manage staff so we take into account that, you know, they might be working different times of the day, but it doesn't matter as long as they kind of produce the outcomes. And I had one other question just for Alison on the digital inclusion project. I know we did do work on this before, because a year or two ago I was in Southall Community Centre, and there we had some presentations about this issue. Myself and Councillor Jammy were there, and we didn't feel it was very good at the time. It wasn't very inclusive of local people. Is this project going to work directly with local people to find out what they want and need, rather than telling them what they need? Because that's what the experience of myself and Councillor Jammy was previously. Did anybody else have a question? Because did Councillor Donnelly have a question that you turned your camera on and then turned it back off again? You didn't have a question, did you?
No, thank you, Chair.
Nope. Okay, so I'll hand that over then to Liz and then Alison.
So if I pick them from the beginning, working at home can be expensive. We recognise that heating's on for people and things. We've promoted the opportunity for staff to claim back expenses through their tax code from HMRC. So we're about to re-promote that. We've done a couple of promotions on it, and quite a lot of staff have taken up that opportunity to get some money back from the government towards their home working costs. I certainly agree it's a bit of a challenge after such a long time for people working at home, and they're missing that human company. And whilst the message has always been work at home if you can and keep safe, Paul Nizarak, the Chief Executive, has also changed his messaging during our staff briefings to say, you know, work at home if you can, but if your well-being suffering, we recognise that you should come back into the office. So, and we have a process for that to make sure they're safe and everyone's socially distanced. There's not many people in Percival House at the moment. So we do have staff coming back in. Just sometimes they just need a day a week back in the office just to see a few faces and get out the house. I think it's really important that we don't force people to stay at home, and I certainly wouldn't, you know, promote that ever, forcing them. In terms of the sickness absence, I think it's an interesting one. I do think there's been a few people when you talk to them and that you can hear they're not sounding well, and you have to say, actually, just turn your kit off, take a day off, that's what you need to do. But I truly believe that some of the sickness absence has gone down because a lot of our staff are not commuting anymore. They're not travelling. They're not coming into, you know, they're not interacting with lots of people on the tube and the buses and picking up the germs they would. And we also think that the wearing of face coverings has made quite a big difference because so few people have colds this year round. I mean, it's just quite amazing. So I think there's some genuine reduction in sickness, but we obviously will keep an eye on it, and we wouldn't expect people to work just because they're at home. Absolutely not. And in terms of the home working and the management of home workers, we've put in place a lot of resources. It is a different situation managing people at home, and we're not totally there yet. We've changed our performance appraisal process to say it's not about scoring someone once a year, it's about having regular conversations, putting the camera on, having a chat with people, doing that well-being piece. We're not totally there yet, so we have the vast majority of managers, I think, are very flexible, subject to service requirements about when staff do their hours. We recognise people are juggling, you know, childcare at home at the moment, and that's quite challenging. And we're encouraging people to take time out their working day to go and get their flu vaccinations, their COVID vaccinations, do their testing. I would say we're not there yet. I think we've made good progress, but clearly the staff do feedback where it's not working for them. They will come to us and say, you know, I need some flexibility about my working hours. I'm struggling to get the message across, perhaps with my line manager. But I think there has been a massive shift over the year in terms of managers supporting people to work flexibly. I think we'd rather they work flexibly than not at all.
Great. And Alison, did you want to come in on the digital inclusion point?
Yeah, I suppose what I'd like to say is that the partners that we're working with, it's a charity, and their business is addressing digital exclusion and finding that evidence about the whereabouts we might have particular problems, and they will be doing a digital exclusion assessment for Ealing, including a risk heat map. And one of the things that they will also be doing in partnership with us is digital inclusion workshops with our voluntary organisations, and we have an ongoing dialogue with those organisations anyway, and that's a topic that is brought up many times when we meet with them about people's difficulties in accessing some of the council services, but also customers accessing, for example, universal credit and financial assistance. So I'm confident that we will have some better evidence and outcomes working on this project. But I'm quite happy to give anybody who wants a bit of a more detailed outline of what we'll be working on, let me know, and we can do a more detailed presentation with the project manager on this.
Right, thanks, Alison. I mean, what I could do perhaps is send you the report that myself and Councillor Jamu did of the last time, as I say, Southall, people in Southall were asked about this, because one of the things they said was Ealing Council keeps coming to us and asking us, you know, giving us these little projects on digital inclusion, and then they disappear and don't come back for another couple of years. And I'm just worried they're going to say, exactly, you've done the same thing again. So we will make sure that we send you, it was the Future Ealing panel the year before last, we'll make sure we send you the notes that myself and Councillor Jamu did of that meeting. So at least there's some continuity, and we don't do what we told them we wouldn't do again, but it sounds like we might be doing again. So, but thank you for the update anyway.
Yeah, hopefully not. So.
Yeah. Perhaps we might finally break the back of it this time round. But listen, thank you very much to the three officers who fed back there. I think, like I say, it was some you know, really detailed information. And I think, you know, as Liz said, we're not quite there yet, but we're getting there. And it has been a huge challenge to move to this new way of working. So thank you to all of you for feeding back to us, and also to the staff for all the work they're doing. Great. So we'll just move on then to the final update that we're getting, and this is on education, and the education service obviously a big part of you know, what's happening at the moment with COVID. And we've got Julie Lewis, who's the director of school standards and partnerships, and we also have Tamara Quinn, who is the strategic lead for business planning and resources, I believe, who's here as well if we've got any questions. So go ahead, Julie.
Thank you very much. I'm struggling to get my PowerPoint on the screen, so I don't know whether colleagues, whether Tamara can manage to get it up.
You've clicked the green button, have you?
I've clicked the green button.
Yeah.
A little white set of windows has come up, but I can't see my PowerPoint.
So I'll have a go.
Oh, go for it, Tamara. Sometimes it's on the second page. I found that recently. So at the bottom, it allows you to go to the next page of screens.
Aha.
Looks like Tamara is getting there.
Well done,
Thanks, Tamara.
So maybe click.
Perfect.
Thanks. So I'll canter through this because I'm aware how late it is, and I'll just kind of draw some attention to just some key issues really impacting on children and young people and our schools since the lockdown in January. So we'll just flick to the next slide on attendance. These figures were kind of compiled last week, so a little bit out of date, but around about 9% of our children are attending school at the moment. And I'm sure you'll know that schools were asked to remain open for children on education, health and care plans, children who are deemed vulnerable and who have a social worker, and children of parents who are critical workers. So at the moment, the profile of attendance of those groups is broadly the same as it is nationally, with over a third, actually nearly 40% now of children with plans attending school, nearly 40% of children who are deemed vulnerable attending. And you'll see it's quite a different spread over primary and secondary, with far fewer young people attending secondary school. So if we compare that to how things were in the very first lockdown, we've got a lot more children and young people in school now. So if we flick to the next slide, what I wanted to sort of draw attention to really are the notable discrepancies across providers. And this will be for a number of reasons, to do with schools' own risk assessment processes, the capacity of staff, the models for learning that schools have developed, but it is something that we're paying close attention to, because you can see that the number of children attending school, there's quite a range in primary, quite a range in secondary, less of a range in special, because we're trying to get as many of those children in as we can. But it's worth noting that attendance overall is lowest in our Southall primary schools, and highest in our Ealing primary schools. And then in secondary, pretty much the same picture. So parents are more reluctant to send children in Southall than other areas of the borough. And then we've got this big range in attendance. So for example, in our secondary schools, for children who are deemed vulnerable and with social workers actually attending on site, the range is from 4% to 82%. So we're looking very closely at why that is. And in secondary schools, it has been right from the beginning of the pandemic, very, very hard to get young people to come to school when there's nobody else there, and when there are no peers and very limited chance of interactions. So one of our key concerns is making sure that we're keeping all of our young people safe, that we're looking after their well-being, their mental health, as well as doing everything we can to engage them in learning, which I'll come to in a sec. And then we get to the sort of more controversial issue, perhaps, of parents who are deemed to be critical workers. So it's the next slide. And the government produced a very wide-ranging sort of definition of eligibility, which meant, there has been a bit of a stampede for places, and because the government didn't produce any prioritization criteria for those parents, it's been very much left down to schools and heads to prioritize, and that's been extremely difficult. And the reason that some schools have had to prioritize is that numbers have spiraled up to over 200 in about 3 of our schools. There are 4 schools with well over 100 key worker children, and schools are now grappling with, in addition to that, the sort of demand for nursery provision as well, and trying to roll out high quality remote learning for all children, and grappling with staff, many of whom have also got children at home. So it's a very, very challenging time. So if we go to the next slide, in fact, I probably covered the next slide. So just really reflecting on the huge pressure on families as well, and of course, the pressure on families is not equated to whether you're a critical worker or not. It's across a much wider spectrum of need and of work pressure and of course of risk of unemployment for many. So very significant pressures on families at the moment, creating real tension. So if we go to remote learning then, because this is by default the main, on the next slide, the main provision for children at the moment. And I think the Scrutiny panel was interested in, this the provision of laptops and the access to the internet for our children and families. So we did a survey just over a week ago, and from that survey, it was very clear that nearly 90% of our schools are saying that even after they've got hold of all the devices that they can possibly get their hands on through the various published schemes, that they still haven't got enough. And we had 57 schools respond to the survey, and we'd identified nearly 5,000 or 4,800 devices that were needed in those schools. And we think probably the figure's nearer 6,000 across all schools. So we're still short of hardware, of devices. But I think, for many families and for many pupils, that's not the main issue, and we've got huge numbers of children and families still without sufficient internet access for home learning or with insufficient broadband width to access the kind of learning that's being created. And it's schools in the Greenford, North Holt, Perivale and Southall that have reported the highest numbers of children without access to devices. So we've got real disparities there, as you would expect. So on to the next slide. Up to 1/3 of pupils in secondary and up to 80% of pupils in some of our primary schools have restricted access. So it's a completely uneven playing field at the moment, and schools are reporting many issues, and particularly in primary schools where children are having to compete with siblings, older siblings who tend to be prioritized in terms of access to devices and the internet, and also quiet spaces. We talked about data and broadband restrictions, and especially when schools are moving to more live streaming of lessons, which do take up more data. So needless to say, competing also with parents who are working at home in some very crowded spaces, and particularly in primary schools, a real reliance on the technical know-how and engagement of parents in the digital platform and how it works, and many English as an additional language barriers, because schools are needing to have conversations with parents of a kind that they haven't had before. So again, it just throws up huge disparities of access. And then if we flick to the next slide in terms of the expectation of schools, and the DfE has become sort of more prescriptive in terms of the expectation, ranging from 3 hours to 5 hours a day, but very sensibly talking about using the word blended in any kind of approach, recognizing that it's not healthy for anybody to be stuck in front of a screen all day or for 5 hours a day. And actually, children can only really attend for short focus periods to any kind of instruction coming at them through a device, and the need for lots of variety and structure within the day so that there's a balance of kind of new content, interaction with peers, interaction with their teacher, and knowing that somebody cares, cares about whether children are logging on, whether they're submitting homework, and recognizing that for a lot of children, the computer is still pretty irrelevant, and textbooks and really high quality paper resources, well managed, can be as effective. So a laptop in itself isn't the answer, and these are some of the messages that we're coming back to us from our schools. So just drawing this bit to a close then on the next slide, in terms of the local picture, schools have just been on a massive learning curve. There are some just earth-shattering things going on in schools, really exciting, dynamic implementation of all sorts of ways of connecting with children at home, really strong adaptive technology for children with special educational needs, which I think is a real strength in Ealing, and schools really networking with each other through remote technologies in ways that they haven't done before to share what they're doing. So everyone's on a learning curve here, but a real commitment to try and give children the very best deal that they can in these very testing circumstances. So that's it on remote education. And then we've just got a couple of slides on other kind of resource issues. So we'll just flick through those. Perhaps I'll take this one and then hand over to Tamara. So with holiday provision, we know today that Boris Johnson is hoping to begin a return to school around the 8th of March, but that very much depends on hitting the vaccination targets that Anna talked about earlier. and there's currently no expectation that schools will remain open over half term, and this was a real well-being issue for schools in the last lockdown, where heads and leadership teams in particular were literally working 24/7 and not having any break whatsoever. So no expectation, although some of our schools, we have profiled our schools, and some of them are actually going to stay open over the half-term break because they feel it's the right thing to do, and we'll be really working to identify those parents where the need is desperate, and helping those families where we can. So that's the Family Information Service surveying all schools to see whether there is provision out there for families who desperately need it. And then with wraparound provision as well, a really mixed picture across the borough. Not all schools are able to offer breakfast and after school clubs for a whole host of reasons, but doing their best to provide for families that need that extended day. So over to Tamara to just wrap up really on some of the other ways that we're working to support schools and families.
Yes, so free school meals has been an area of real interest. The catering providers have improved their meal parcel offer. So subsequent to a lot of media attention, there is an improved offer in Ealing through the range of providers we have. Many schools are moving towards the voucher scheme. So subsequent to the lockdown being announced, the government announced a voucher scheme that launched on the 18th of January. Some schools have joined the National Voucher Scheme. That was the same scheme that operated during the summer. But a number of schools have chosen to use the council's provider for the winter grant scheme, or are using a local offer. Parents are being issued £15 vouchers a week, which is the same value as the previous scheme. And I think logistically for schools and following feedback from parents, vouchers is absolutely the kind of the preferred method of delivering that type of support to families. The catering providers will provide meal parcels to schools. So there are some instances where families have been offered both, where there's a need or there are concerns about whether the voucher will be spent on food for that young person. In terms of the winter grant scheme, so they announced the winter grant late in the autumn. We delivered vouchers to families over the Christmas break. So families were offered £30 per child over those 2 weeks. The council have already committed to the half term in February. That's 1 week. So families will be issued a £15 voucher for February half term. For under fives, a £25 voucher was issued for qualifying households. And for the February half term, a £20 voucher will be issued. And from the next financial year, so from April onwards, the government's announced that there'll be a holiday activities and food programme. It's not yet clear exactly how that's going to be delivered, but we'll be working through that in the coming months with the relevant decision making coming to members on that.
Thanks, Tamara. And then I just summed up in the last slide, just if you flick to the last slide, just some of the challenges. I wrote these slides a couple of days ago, so further delay in return to school now likely. So I mean, even in the best case scenario of children beginning to go back to school on the 8th of March, we know that it's unlikely that that will be rolled out for secondary aged pupils. It's likely to be longer, and so that further delay just continues to perpetuate a range of kind of inequalities. There are additional pressures at the moment in terms of nursery provision and funding, which are going to cause potentially a significant strain on budgets. We know that the vaccination for the lobbying for the vaccination for teachers, hasn't materialised, and that the government's sticking to its the criteria that Anna outlined earlier. So teachers are not being prioritised. So that's a factor. And then we've got ongoing disruption for pupils in these key, really critical transition years in their education journey and exam groups, and particularly for those students doing vocational subjects, which are so much harder to deliver through digital platforms and remotely. So that kind of risk of NEET is something that we're very focused on in the Ealing Learning Partnership, and we're working with the skills and employment team to do all we can to support those young people that are most at risk of not securing employment in what's becoming a very impacted set of employment prospects, post-pandemic, etc. So the attendance of vulnerable pupils and vulnerable pupils in general remains a concern. And then those uneven impacts that we've talked about for disadvantaged and also our BAME families who have been for a number of reasons more impacted than non-BAME families in this pandemic. That's it.
Great, thanks both. Have I got any questions then from councillors, either in the chat or if you put your hand up? If you can share the screen, that'd be great, because it's hard for me to see who's got their hand up. I think Councillor Padda's in again. Go ahead, Councillor Padda. Could we share the screen, Tamara?
Yes, I'm just working on
it. Great, thanks. Yeah, Councillor Padda and then Councillor Mahmood and Councillor Steed. Go ahead, Councillor Padda.
Yeah, thank you, Chair. I've only got one small question on NEET. It's how are we going to manage that? Because NEET, it's really quite a serious thing. It's people, especially this, I think that will impact mostly in the BAME communities. I'm really worried about that, because I know we can't do much because of COVID in other areas, but are we managing it in somehow, looking at it, keeping an eye on that somehow?
Yes, I'll bring you in a second, Julian. We'll just get the other two councillors. Go ahead, Councillor Padda.
Thank you. Okay,
great. Councillor Mahmood.
Thank you, Chair. Just wanted to ask some clarification. I think I missed that, and I just wanted to know from the thing about the remote education. Thank you, Julie, to update us. We have got dream to see Ealing, digital Ealing, Ealing, modern Ealing. Well, I just wanted to know, or I have missed that. You said 90% children have got access to the devices or access to network or internet. And you mentioned Greenford, Northolt, Perryville, and Selborne. So sorry, could you clarify that? You said 90% people have got access to the devices and internet. So we are not on that point where we would start worrying things. People are looking for devices or they have got no internet access. So I just wanted to clarify that. If it is the case, so what can be done on that?
And Councillor Steed.
Thank you. Sorry. I don't think this is the same question that Councillor Mahmood asked, but it in the same area, certainly. The 4,800 or maybe 6,000 devices of which we're short of, or our pupils are short of, what is the issue there? Is it that there just are no devices to have, or is it an issue that for whatever reason and the requirement that we need isn't getting through to someone who controls the distribution of the devices? Yeah, and that figure that Julie, you gave of 4,800 or maybe 6,000, what's that in total as a kind of rough percentage of the number of pupils who do have devices, if you see what I mean? I hope that makes sense. Thank you.
Yeah, and I think Councillor Donnelly's took his hand up as well, so we'll take that one too.
Yes, just trying to get to grips with the early stats, Julie, would I be right in interpreting them to say that we've got parts of the borough, brackets, typically but not exclusively the more affluent parts of the borough, where attendance at primary school in particular is higher than we might reasonably have expected it to be, and we've got other parts of the borough, brackets, typically the less affluent, where we have fewer of the children that we absolutely would have expected to be in attendance? Because it's almost like there's an inverse proportion, that the more digitally connected parts of our community are actually not where the problem is in terms of having to work. The biggest problem are in terms of having to work from home, because more of them are turning up at school unexpectedly and not in accordance with the precedent of the phase 1 of lockdown. So how do we interpret it?
Okay, thanks. So are you happy for me to come back?
Yeah, go ahead, Julie.
So just on the stats then, to Councillor Mahmood's point, we did a very quick survey to find out how many schools were still short of devices, and 90% said they were still short of devices of the ones that we surveyed, 88%. So the issue is cost, because I think for many, I think the supply issue has pretty much been sorted, although there were a lot of teething problems in the early stages, and the quality of some of the devices that have been supplied hasn't been great either by the DfE. So this is about cost, and this is about schools using up their own reserves, or and also exploiting every avenue possible to get hold of devices. And Tamara may want to come back on that one as well. But in terms of the query about attendance, yes, the schools with the highest number of children in are in the more affluent areas of the borough. There are primary schools with over 200 children in. They are big four-form entry schools, but that's nearly a quarter of children in, and there are others with less than 5%. But what I will say is that the numbers are to do with critical worker children. So we're pretty confident, particularly in the primary phase, that all the children that should be in school are in school. If we're talking about our most vulnerable children and our children with special educational needs and disabilities in mainstream, those children are mostly in school, and we're going through those figures now. So our concern really is not so much with attendance, it's about the demand by parents who are eligible under the critical worker category, and the demand, and then the pressure that's putting on the system, because quite rightly schools are now very much focused on the quality of education provision for the vast majority of children who are at home. So the offer that they're able to provide for children on site is really mirroring that, but you've got to have staff, you've got to have bodies, and then if you open up your nursery as well, you've got fewer bodies. So it's a real resources issue for a small proportion of schools. It's not a major problem for a great majority of our schools, but it's concentrated in the wealthier pockets of the borough. Okay. Oh, and the question on NEET, yes, I can say, at the end of last year, when we were very impacted, our NEET figures didn't increase. So that was very good. And that's largely due to the quality of tracking and support for those young people, and our work with the college. And the college are doing some really innovative work to try and give students a second chance, so to enroll in January as well as September, and we're trying to really keep as many young people in education and training for as long as we can, because entering the job market at the moment, with the sort of some of the impacts on apprenticeships etc., is not a safe option. So we're trying to keep as many young people in education as we can at the moment.
Thanks, Julie. Just to come back on the issue around the survey, I mean, it's quite worrying, really. I mean, it's pretty shocking data there to say that, you know, that percentage, 90% of schools say they haven't got enough IT provision and also the access to, you know, broadband. I'm just wondering what else we can do. I suppose there's like a few different routes, isn't there? So one is, you know, hassling the government. So are we doing enough? I mean, should we send that survey data out beyond Ealing? Should we be publicising it? Should we be, you know, putting it up on Twitter or sending a letter to the government and saying this is shocking? So perhaps we should do that. Then also, are we putting schools into contact with local charities and organisations that can kind of fill this gap? And then I suppose the final one is does Ealing Council have any money itself that we could use to try and plug this gap? Because it seems like this is a gigantic issue that, you know, is going to cause real problems for young people's life chances in the future. And not only that, again, it's like BAME kids, working class kids. Every single thing that we've looked at, it's always Black, Asian and minority ethnic kids that have been hit the hardest and the poorer kids. So it's kind of disadvantage upon disadvantage. So what can we do in terms of those three areas?
Thank you. Firstly, to say that the survey data we produced in response to a plea from London councils, from Councillor Campbell. And so we sent the data to London councils and they're lobbying on our behalf. So it definitely has gone somewhere. What else can we do? I think that's the question that, you know, we're really keen to hear sort of creative ideas around, because we would have to kind of go through each school one by one to look at, you know, whether the school itself has allocated sufficient resources to this, whether you know, whether the schools with the high numbers are schools with you know, that are struggling financially anyway. But I think anything that we can do to kind of marshal a local response would be really helpful. And I don't know whether Tamara's got anything to add to that in terms of sort of tapping into other kind of resources or pots.
Yeah, so I think from a budget perspective, schools have the budget for learning resources, but clearly wouldn't have been planning to buy hundreds of devices for individual schools. Schools in Ealing are generally well funded, and schools still, to a large extent, have large surpluses in a number of, and have surplus balances. We have a small number of schools in Ealing compared to other boroughs who are in really severe financial difficulty. So we would expect that schools do put their own resources in place where there are young people in most need. The number of devices, if we extrapolate it out to 6,000, is something like it's about 15% of children in schools. It doesn't mean there's no device in the household. It likely means that there are young people sharing within the household and parents managing the kind of timetabling across young people. So there are a number within that who still will have access to a device. The London Grid for Learning have procured around 100,000 devices for London boroughs and schools within London, and they're continuing that procurement, and Ealing schools have taken advantage of that and can continue to order. So that's well publicised with schools. In terms of local initiatives, we've had some charities kind of donate small quantities of devices, but really the consistency of device, the software on it there are complications with that, and to some extent it can be more trouble than it's worth. Actually, the kind of the paper learning packs are, you know, sufficient alternative to engage those young people in learning rather than a device that doesn't have the software that's required. So that there is a mixed approach, and schools are prioritising and rotating devices as well, to ensure that young people have access to devices at various points in time.
Okay, Any further questions on this? Or we?
But just
Yeah, go ahead, Councillor Mahmood. Yeah.
Just to, I'm very passionate about to see the children with the laptop, with the access to the internet, and that's why I'm working in some sort of way that, like Chair, you suggested different charities can be helpful as well. The big charities as well, local charities as well. Bill and Melinda Gates, they have got dream to have every children should have his own device, you know. But so Tamara, your point, I just wanted to clarify that. Do you think this is a more coordinated way if the school will provide the devices and that is their responsibility to provide the devices rather than us as a local authority or as a local charity?
So I think our role is absolutely to lobby government. So we're doing that with our contacts through the DfE and our kind of contributions to that information to London councils. So I think it's important that we press government as far as possible to secure devices that are centrally funded. Where that's not possible, there is an expectation that schools do meet some of that gap. It won't be able to be met in all cases. Some of it's through the availability of supply and some of it's budget. What we have said to schools, though, is that they you know, if there is a significant budget challenge, that they work closely with the local authority, because a budget challenge shouldn't necessarily be a barrier to providing devices. So there are a range of approaches. And so I think school leaders are taking responsibility for that. I think it's been challenging because the government's position has changed. So the number of devices that have been delivered has been increased and then reduced overnight and then increased again. So it's really just shaking out now a really kind of clear understanding about which children have devices, how many devices that schools have been allocated, and having an extended period where you have you know, an expectation of home remote virtual learning. During the previous lockdown, the education expectations were very different to now, and through the term, the expectations were through periods of self-isolation that young people had access to devices. Now we have the vast majority of children at home. So I think it's taking a period of time to work its way through. Schools are becoming clearer about where the gaps are, where to prioritise, how to rotate, and are now thinking about putting more orders in for laptops. When they'll arrive will be another matter, but it's really crucial they do get high quality devices, not just kind of devices for devices' sake. They need to work with the platforms that the schools are using. So they're using, some schools have Google, some schools have Microsoft. So a young person's ability to engage in those lessons, it's equally important that they have a suitable device to do that, or the alternative will be the home learning packs.
Right.
Chair, thank you, Chair. Can I just...
sorry, Councillor Mahmood, I think I had Councillor Sumner first. Yeah, okay. Were you waving to speak, Councillor Sumner? Yeah.
Yes, please. Thank you, Chair. I'm sorry if I missed it, but I used to use the J. Lyons charity, which was formed from, I think it's the A41 road, and they have a very high level of support for schools. And I know that Ealing should be into them on an annual basis for money, because they have a load of it. Okay, and I know that Ealing, being one of the original people who built the road, I'm sorry, this is, I haven't got all my facts together, but go with me on this. I know that I got a lot of money out of them for something I was doing in environment between 2006 and 2008. And it meant going to a couple of interviews up at Harrow School. So that's where the John Lyons School is as well. I'm sure that Julie Lewis has heard of the charity. And, yeah. And I'm sure that they've got plenty of money to support your computers, yes?
I'll just take Councillor
Mahmood. You've been in for them for a lot more money, of course.
Thanks, Councillor Sumner. I'll just take Councillor Mahmood wanted to jump in. If anybody else does, just stick their hand up now, because this is the last round. Councillor Mahmood, you wanted to add something?
Sorry, Chair, but I completely agree with Tamara and Julia suggested, but still I will follow your question, Chair. So Tamara, clarify that. So if any local charity come forward and try to help in terms of devices, so a school is the point of contact, not the local authority. Is that what you are saying?
So, sorry.
Yeah, go ahead, Tamara. Yeah, if you can answer both of those.
Yeah, so in terms of local charities, some charities have approached schools directly and some have come through the local authority. Where they've come through the local authority, we have either helped coordinate the allocations or we have put them in contact with the relevant schools. So some of the charities have had criteria about it being for special education needs, etc. So we're happy to coordinate that, and those schools have gratefully received those devices. So we had a small quantity of iPads from an organisation that we distributed. So yes, they are making use of those. And if there are any organisations that you're aware of, please put them in contact with us and we'll make sure that we coordinate with them. In terms of John Lyons, schools do apply for funding to John Lyons on an annual basis, and they continue to do so. They apply for a whole host of a range of kind of programmes within the school around wellbeing, etc. Julie, I don't know if you.
Yeah, we've got a few John Lyons sponsored programs running already through our school partnership and enrichment team. So we're in conversation with them now about a next round of funding. So, you know, it is something that we could look into in terms of devices. I'm just not sure whether they, you know, that's their ethos, you know, to do, you know, to fund kind of equipment as such, but we can pick that up.
Great. Okay, I don't think I have any further questions. I think just in terms of the kind of notes and sort of moving forward, I mean, it does sound that you know, we are quite concerned about those figures, and I think, you know, we would be asking for officers to do as much as they could in the three areas that I think I mentioned. So it's, you know, lobbying nationally, because at the end of the day, it should be government paying for this rather than charities. But, you know, lobbying nationally, working with local charities, including the charity councillor Sumner mentioned, and also the working with looking at, you know, whether Ealing needs to add some funding. I know some councils, I think, have used S106 funding to pay for dongles, whatever they're called, for some schools. So I think we probably want to recommend that, you know, we do the maximum we can in all three of those areas to try and improve the situation for those kids who don't currently have access to online learning. So I think that's probably all we've got time for tonight. We've kind of fitted in a lot. So thank you very much to both to Julie and Tamara for covering the education piece, and to all of the panel present with your questions, and for sticking with us to the end. So we've just got some very quick items at the end. So the final item is item 9, the work programme. Our next meeting, we are going to cover education again, and I think we probably do need to, because there'll be further updates on education the next time round. We have nothing else on the agenda for that meeting, but I think we will need to look at preliminary or draft what's the word I'm looking for? Draft recommendations. So if anyone does have any recommendations from the last 2 meetings that they want to add, please just email them through to Anna Marie. I don't know at this late hour if anyone's got any particular suggestion that they want to see on the agenda for next time. If you do, you can stick your hand up. If not, myself and Councillor Sumner can work with the officers, and I'm sure we'll come up with some other areas to look at. Is that okay with people, rather than keep you any longer? Okay, great, I'm getting thumbs up. Great, so then the final item, which I think is item 10, I don't have the agenda in front of me, is the date of the next meeting, and I think that was the 24th of March.
Correct.
So brilliant, so I will see you all on the 24th of March. Thank you very much for coming tonight, and thanks to all the officers for their support, and we'll see you all soon.